Okay, picture this. You've got a patient, they slide into your consultation chair, and their smartphone. It's practically glued to their hand.
Hmm.
They're armed with screenshots, maybe from Reddit, maybe TikTok, all about botched procedures. They're not just curious anymore, they are full-on skeptics.
Oh, absolutely. It sounds
Mm,
familiar, right?
totally. Welcome to what we're calling the new era of aesthetic
Oh,
medicine.
yeah.
It's this world where trust, well, it isn't just handed over, you have to earn it painstakingly. Every single interaction, every word.
It's so true. The whole landscape is just profoundly shifted. Patients today, they show up having waded through just, tons of conflicting opinions online.
Right.
They've read all the horror stories, the cautionary tales on social media, and they're openly questioning, is that natural look you're promising actually doable for them?
Exactly. They aren't just buying a procedure anymore.
No, they're investing, really investing in a deep sense of trust.
And that huge shift, that's exactly what we're diving into today.
Mhm.
We're going to unpack these incredible, really actionable insights from a masterclass by Dr. Ari Masudi.
Ah, yes, Dr. Masudi.
For anyone who doesn't know, he's got this fascinating background, molecular biologist, former researcher in regenerative medicine.
Right, and now a science tech business consultant. Highly sought after.
Precisely. And his masterclass is specifically designed for aesthetic practitioners like you listening now. It's basically a blueprint for winning over these, well, increasingly skeptical patients.
Yeah, our mission today really is to pull out the most important, most potent nuggets of knowledge from his work. How can authentic communication really forge that unwavering patient trust, especially in what people are calling this post-truth era?
Post-truth era. That sounds intense, but it feels kind of accurate sometimes, doesn't it?
It does. It's sort of a time when, objective facts sometimes feel less impactful than someone's personal story or just how authentic they seem.
Right.
So we'll explore why the game has changed so much, and more importantly, the practical strategies.
Mm.
How do you not just survive, but actually thrive in this new landscape?
So what can you, our listeners, expect from this deep dive? Let's be clear. This is not about dusting off old sales techniques.
Definitely not. Forget
This
that.
is about really getting inside the head of today's patient, understanding that shift in psychology, and then applying these specific, powerful communication pillars Dr. Masudi talks about.
And we're going deep. We'll even get into the tricky stuff, like how to handle complications when they inevitably pop up,
Which they do.
and how to build that crucial trust online, your digital presence.
It really feels like a complete paradigm shift for anyone in aesthetics looking to connect better and build a practice that lasts.
Absolutely. And, to really appreciate Dr. Masudi's insights, we first have to get a solid handle on this evolving patient psychology. Like you said, today's patients, they are swimming in data.
Drowning almost.
Yeah, drowning is a good word. Conflicting info from Instagram influencers, medical forums, those comparison websites. They're not just casually curious. They often walk in the door with a huge amount of pre-existing and often contradictory knowledge, or maybe misinformation.
It's what Dr. Masudi calls information overload syndrome. So apt.
It really is.
They've seen it all, heard it all, and honestly, they're kind of exhausted by it. Did you know there was this 2024 study, American Society of Aesthetic Plastic Surgery?
Oh, yeah, I saw that.
It found that a staggering 78% of patients research procedures for over 3 months before they even book a consult.
3 months. Think about that.
3 months of scrolling, comparing notes, potentially soaking up bad info or, just fear-mongering content.
Exactly. It's a huge time investment on their part, just gathering data.
And all that homework, that intense research, it leads right into the second behavior we're seeing, right?
Yeah, the proof first mentality.
Yeah.
The days when, a few glossy before and afters were enough, gone.
Totally gone.
Patients now, they want hard evidence.
Mm-hmm.
Verifiable credentials. They dig through authentic reviews like detectives,
Mm-hmm.
and they want to really understand your specific technique.
Mm-hmm.
How do you do it? Why is it different? What makes it right for them?
Which flows perfectly into the third point, especially now with the economy being what it is.
Yes. Value-conscious decision-making.
With all this economic uncertainty floating around, patients are looking really hard at every single dollar. It's not just, can you do this anymore?
No, the real question under the surface is, why should I pick you? Why not the clinic down the street offering a discount?
Right. What's the unique value you bring that justifies this investment? Because it is an investment time, money, and trust.
They want that ROI, and it's not just about the physical result.
So, okay, what's the implication for practitioners listening? Dr. Masudi is super clear on this, isn't he?
Crystal clear. Stop leading with your fancy credentials or trying to prove your technique is superior right out of the gate.
That old way.
That approach, yeah, it might have worked once, but now it just feels dismissive to a patient who's already done their homework, even if they are skeptical.
So the focus has to shift, fundamentally shift.
To understanding the patient's specific, often unspoken concerns first.
Okay, this is where it gets really interesting and maybe a bit counterintuitive for some docs. When a patient asks about, let's say, lip fillers,
Right.
they're not really asking about hyaluronic acid properties, are they?
Not usually, no. They're asking, will I still look like me?
Will it hurt?
Will my partner notice? Or
Ugh.
my colleagues? Or will I just look, I don't know, better?
Yeah, the questions are rooted in their personal life, their anxieties, their hopes, not just the science.
And that's precisely why, as Dr. Masudi points out, that old school, I have the doctorate, just listen to me approach, it's dead in the water.
Totally ineffective, creates a wall, not a connection.
Exactly. Instead, his masterclass gives us these 4 pillars of trust-building communication. And these aren't just, like, nice ideas. They're essential.
Okay, let's break these down. Pillar number 1, be personal, not just, professional sounding.
Right. The problem Dr. Masudi sees is that practitioners, trying to sound authoritative, often end up sounding like walking textbooks.
Like reading from a script. We utilize advanced dermal filler techniques.
To enhance facial volume and restore youthful contours. Yeah, clinically accurate maybe, but it just lands flat. No connection.
So the solution.
Deceptively simple, really. Speak their language, the patient's language.
Okay, give me an example.
Instead of that jargon, imagine saying something like, okay, so I hear you want to look refreshed. Maybe like you just got back from a really relaxing vacation. Right. But without anyone asking if you had work done.
Ah, okay. That instantly connects with what they actually want.
Exactly. So the action steps are swap the clinical jargon for everyday words, talk about their actual life situation. Like, okay, as a busy mom, I get it. You probably want minimal downtime, something that won't mess up your schedule.
And ask about lifestyle before recommending anything.
Crucial. So instead of, we recommend a comprehensive facial rejuvenation protocol. Try, let's just talk about what bothers you most when you catch your reflection in the morning.
That makes it about them, their life, their feelings. It's a total reframe.
Totally. Which leads nicely into pillar 2, be clear. Because complexity, it kills confidence fast.
Right. If they don't understand, they can't trust.
Precisely. The issue Dr. Masudi flags is that overly technical explanations, they create distance. If you start explaining the molecular structure of Botox,
Their eyes glaze over.
exactly, they stop listening, they get overwhelmed, and then they start doubting if they even know what they're signing up for.
They're not there for a biochem lecture, are they? They want a result.
So the solution is simple explanations. Focus only on the outcomes they care about, not the complex mechanics behind it.
Okay, so how do you do that?
Explain things in terms of what they'll experience. Use visual aids if you have them, analogies they can relate to. Break down complex treatments into simple steps.
Like the Botox example from the masterclass.
Oh, it's brilliant. He says, think of it like this. Botox works like putting your worry lines on vacation for about 3-4 months.
Huh. I like that.
The muscles that make those lines just relax. So your face looks naturally refreshed. It's simple, memorable. They get it instantly.
Yeah, it turns a medical thing into a positive experience, a feeling.
Exactly. And that ties into pillar 3. Be positive.
Yeah.
Because using fear, that backfires.
Yeah.
Big time.
How so? What's the common mistake here?
A lot of practices, maybe without meaning to, focus on what's wrong with a patient's appearance. Or they use subtle scare tactics about aging. It just breeds insecurity.
Yeah, nobody wants to feel worse walking out than walking in.
Right. So the solution is to focus squarely on enhancement, on empowerment, not correction and fear.
Talk about how the treatment will make them feel, not just look.
That's critical. Build genuine self-confidence, not just fix a perceived flaw.
So practically, that means maybe not using before photos that really zoom in on flaws dramatically.
Right. And frame aging as natural, while positioning treatments as choices. Choices for confidence, for feeling good.
So instead of saying, wow, these deep wrinkles really make you look older.
You could say something like, this treatment can help you look as vibrant and energetic on the outside as you feel on the inside. See the difference.
Huge difference. Focus on the positive potential. Okay, pillar 4.
Be plausible. Realistic expectations. This is absolutely fundamental for building trust that lasts.
The big problem here is overpromising, right?
Definitely. Telling someone, oh, you'll look 10 years younger. It's just not believable most of the time, and it's often not achievable. It sets everyone up for disappointment.
And negative reviews down the line.
Absolutely. So the solution, set realistic expectations, but still highlight the genuine benefits.
How do you walk that line?
Show realistic before and afters of patients who are similar to them, similar age, skin type concerns, not the super filtered, perfect ones.
Be honest about what treatments can and cannot do.
And be upfront about things that affect results. Age, skin condition, lifestyle. Transparency is key here.
What's a good way to phrase that?
Dr. Masudi gives a great example. Most patients see a noticeable improvement, but it's natural. You'll still look like you, just, more refreshed and confident.
That's good. It manages expectations but still sounds positive. Authentic enhancement, not total transformation.
Exactly.
Okay, so those are the 4 pillars for everyday communication. Fantastic framework. But what about those really tough situations, the super skeptical patient? Or worse, when something actually goes wrong?
Right. That's where Dr. Masudi introduces the trust sequence for handling skeptics and his strategies for crisis communication. Really vital stuff.
Let's start with the trust sequence. How do you turn a skeptic into an advocate? Step 1.
Step 1. Acknowledge their concerns first. Before you even think about solutions, validate their skepticism. Hear them out.
So what would you say?
Something like, I understand you might be concerned about looking, overdone or unnatural. That's actually a really common and valid concern. Honestly, most of my patients share that exact worry initially.
Why does that work so well?
Because it instantly builds credibility. It shows you get where they're coming from, you understand their fears, instead of just trying to brush them off or sell them something.
Okay. Then step 2 is kind of weird. Amplify their concerns. Really?
Yes, really. Amplify them. Take their concerns seriously, and then add context that shows your expertise and your empathy.
Okay, example time. Lip fillers again.
Right. You could say you're absolutely right to be cautious about lip fillers. We've all seen those photos online, right? Lips that look overfilled, unnatural. The absolute key is understanding facial proportions, the harmony, and using just the right amount for your unique features, not just pumping up volume.
So by taking their fear seriously, maybe even more seriously than they stated it.
Paradoxically, it builds trust. It shows you deeply understand the risks and nuances. You're not dismissive. It disarms them. You become an ally, not a salesperson.
Okay, that makes sense. Step 3.
Provide context before solutions. Don't just jump to recommending a product or procedure. Explain the why first.
Give them the framework.
Exactly. So before we talk about specific options, let me just quickly explain how natural lip enhancement actually works. The goal isn't just bigger lips. It's about skillfully restoring maybe some volume or definition you had when you were younger, subtly enhancing your natural beauty.
Setting the stage. And finally, step 4.
Let them decide. Crucial. After all the discussion, the guidance, you put the decision firmly back in their hands.
Empower them.
Yes. A great closing is something like, okay, so based on everything we've talked about, here are maybe 2 or 3 approaches we could consider. Why don't you take some time, think about which feels right for you, and we can chat again about any questions whenever you're ready.
No pressure. Respecting their autonomy, that builds huge trust. Okay, now for the really tough one. Crisis communication. Because, let's be honest, sometimes things don't go perfectly.
It happens, even with the best hands, the best intentions.
And in this age of instant online reviews, viral posts, how you handle it is everything. The old way was what? Defend, minimize, blame.
Pretty much the old approach. But Dr. Masudi offers a completely different new approach, much more effective.
Which is?
It's all about acknowledging, taking responsibility, and focusing immediately on solutions. He has this trust recovery formula, 4 key parts.
Okay, what are they?
First, immediate acknowledgement. Respond quickly, ideally within 24 hours. Don't ignore it.
No hiding.
Second, take responsibility. Own the outcome. No excuses, even if it was a rare complication or something unexpected. Provide solutions. Focus immediately on what you are doing to make it right. Concrete actions, not just apologies.
And fourth,
follow through. Check in regularly. Keep the communication open until the issue is fully resolved to their satisfaction. Show you genuinely care.
Can you give an example, like response?
Sure. Imagine saying this to an unhappy patient. Look, I understand you're not happy with your results right now, and I genuinely want to make this right for you. Let's schedule a time tomorrow. just us, to discuss your concerns properly and figure out a clear plan to get you to the outcome you were hoping for. Your satisfaction is absolutely my priority.
Wow. That feels so different. It shifts it from conflict to collaboration, doesn't it?
Completely. It's about empathetic, decisive action.
And this trust thing, it's not just in the clinic room, right? Dr. Masudi talks about digital trust building, too, your online reputation.
Oh, massively important.
Okay.
This includes your social proof, like your before and after photos. They need to show real patients, realistic results.
Not overly filtered perfection.
Exactly. And show diversity, different ages, skin tones, ethnicities. Show your work helps everyone.
And testimonials.
Go for specific stories, not generic praise.
Dr. Smith helped me feel amazing for my daughter's wedding. That hits differently than great doctor.
Like's more authentic. Captures the feeling. And create educational content online. Answer the questions patients ask you privately. Position yourself as a trusted resource, not just a seller.
Okay, and what about online reviews? That feels like a minefield.
It can be, Dr. Masudi says. Respond to every review, positive and negative.
Every single one.
Every single one. Thank the positive ones, address the negative ones professionally, empathetically, and try to take the conversation offline quickly to resolve it privately.
And definitely don't incentivize reviews, right?
Never. Don't script them, don't pay for them. It just backfires and destroys trust if it comes out. Encourage honest feedback, yes, but keep it genuine.
Makes sense. What other online transparency tools does he mention?
Providing detailed info about procedures, risks, timelines make it easy to find. Be upfront about pricing. It builds trust and qualifies serious patients.
And make your credentials easy to find and verify.
Absolutely. All these little digital details, they add up to create a big impression of trustworthiness or lack thereof.
So when you put all this together, the pillars, the trust sequence, crisis communication, digital trust, what's the payoff?
It leads to what Dr. Masudi calls the trust dividend. It's huge.
Trust dividend, I like that.
Practitioners who master this, they don't just survive, especially not in a tough market. They thrive.
How so?
They often can command higher justifiable prices because the value is clear. They get way more organic referrals, happy patients telling friends, and interestingly, they even tend to face fewer complications.
Fewer complications. Why?
Because patients who trust you are more engaged. They listen to pre- and post-care instructions better, they're more compliant, they feel like partners in their care.
That makes perfect sense.
It really boils down to
Yeah.
Dr. Masudi's core message, which I think is so powerful. Your technical skills, they got you your medical degree,
Right.
your communication skills, those will build your practice.
Wow. Yeah, and in an industry where everyone claims to be the best.
The real winners, long term, are the ones who make patients feel genuinely heard, truly understood, and just confident in their choice. Confident they picked the right person.
So trust isn't just like good ethics.
It's good business. Undeniably, think about it your next patient. Probably Googling you right this second.
Scrolling reviews, checking Instagram.
Making a judgment about your trustworthiness before they even dial your number. You have to make sure everything they see, online and offline, gives them every reason to choose you.
And those skeptics we talked about.
They're not the enemy. View them as your biggest opportunity. A chance to prove that in a world full of hype, you offer something real, genuine trust.
That's the foundation.
The foundation for a practice that's not just successful, but ethical and honestly deeply rewarding too.
So to wrap this all up, earning that trust through communication that's authentic, empathetic, plausible. That is the ultimate competitive advantage today in aesthetic medicine, no question. Ready to transform how you connect with patients. Build that real loyalty. It starts small, just one conversation at a time. Listen more. Really hear their concerns without judgment.
And watch what happens.
Yeah.
Watch those skeptics turn into your most loyal, most vocal advocates. It really works.